Good afternoon, everyone. My name is Beth Trzanski. I'm the Deputy Director of Building Bright Futures. Happy to have you here with us for a webinar around the American Rescue Plan Act and to gather input to inform how the grant program will run out of the Child Development Division. We're going to start today with a pre-recorded message from Congressman Welch, so I'm going to bring that up.
I want to express my gratitude to every person in Vermont who is a child care worker and did so much to help us get through COVID. You know, it's astonishing to me what was asked of you. It's amazing to me what you did do. You had to provide child care and help and security to children and to their parents, even as you were contending with your own challenges in healthcare and wanting to take care of everybody you loved. And you did it and provided that comfort and security and that sense of safety so essential to the well-being of so many Vermonters. Also, we made historic and long overdue investments in childcare, and I urge you to take full advantage of them. We need a childcare system that's flexible, that's safe and secure, and where childcare workers are well paid for the incredibly important work that they do. Thank you, one and all, for everything that you've done.
All right, I am pleased to be here with colleagues at the Child Development Division. We are re-recording this webinar due to technical difficulties earlier to bring you information in a clearer fashion. So I'm going to hand this over to Interim Deputy Director, Deputy Commissioner Miranda Gray.
Thank you, Beth. Good afternoon, and thank you, Congressman Welch, for your remarks. The Child Development Division and the group before you today truly appreciate your support. For those of you who have not had the pleasure of meeting before, I'm Miranda Gray, the Interim Deputy Commissioner for the Child Development Division. I'm beginning my 5th month with the division and cannot say enough about how appreciative I am of how welcoming everyone has been and the tremendous amount of work that has gone into providing care for your youngest Vermonters and school-age youth. Over the last 16 months, we've had countless times that we've had reached out for your thoughts and input for our many programs and initiatives. And I'm grateful that you are so willing to continue engaging. Your input matters as it has allowed us with each program that we have run to learn what went well and where we could do better. I thank you for joining us today to engage in this process and for your patience if you joined us earlier. I now would like to introduce Nicole Dubuque's Child Development Division's new Policy Director. Nicole joined the Child Development Division just a month ago and will be walking us through the interactive portions of the presentation today. Sheila Duranolo is known to many of you for the many programs she has run for the Child Development Division through the pandemic. Sheila is our Director of Programs and most recently worked with several hundred of our providers while implementing the Coronavirus Response and Relief Supplemental Appropriations Act program, fondly known as CRSA. Given her success, Sheila is overseeing our American Rescue Plan Act funds as well. I'd like to thank Building Bright Futures for hosting this webinar today, for helping us spread the word about this meeting, and for your continued partnership. I would also like to thank our existing and new partners, Let's Grow Kids, Vermont AEYC, Vermont After School, AALV, USCRI, and the Vermont Professionals of Color Network for your assistance in spreading the word so we could reach as many providers as possible to be here today. Next slide, please. Today's objectives are understanding the current ARPA stabilization funding opportunity, share your ideas about priorities for this funding, have sufficient information to determine if this funding opportunity is a good fit for your program, understand the next steps for ARPA stabilization funding, and learn about the next opportunity, ARPA opportunity, the discretionary funds. Next slide, please. We also wanted to take a brief moment to talk about all of the programs that we have run the childcare business stabilization, which happened right as the pandemic had started, essential person childcare and incentive, restart stipends, operational relief grants, hubs and childcare financial assistance program tuition, childcare workforce stabilization, and the current program we're running, CURSA. In total, we have infused $54.7 million into the early childhood network. Next slide, please. And now I will turn it over to Sheila Duranolo.
Thank you, Miranda. The federal funding opportunity that we're going to talk about mostly today is called the ARPA Child Care Stabilization Fund. That is $29.3 million and is for current regulated providers. This is not an opportunity to start up programs. Programs need to have been already regulated by the time that, that they complete the application. The state, as lead agency, can hold back 10% for administrative expenses to run the program, but 90% of these funds must be awarded to qualified providers. And you can see on this slide that a qualified provider is currently regulated and open now and serving children, or was previously regulated and serving children, but closed due to COVID-19 related issues, and they're planning to open back up within 30 days of the application deadline. Next slide, please. An important requirement of these programs is stakeholder input. We need you to tell us what is the best use of the funds to stabilize and revitalize the system. We've had several opportunities that are listed here, but are no way the only opportunities that we will have for people to provide input. We're using multiple platforms to collect information. As you can see, in March, the Child Development Division collected information by a survey that we sent out to providers and families. In June, we convened the Child Care Advisory Group, which is a small group of providers who have advised us throughout the pandemic on needs and support. In May, Building Bright Futures used their state advisory committee to bring together a broad range of stakeholders to discuss several federal funding opportunities. And then today we have this webinar. Next slide, please. To ensure that we're not duplicating efforts, we discuss all of our program designs with federal money with a broad range of people. But regardless of the design that we developed, we must follow some state rules for awarding the funds. We either use a request for proposal or an application process. For stabilization, we'll use an application process because this is not a competitive funding opportunity and must go to all eligible providers. However, the next funding opportunity, which is called ARPA discretionary funding, we will use the RFP process, the request for proposals. That focus of that funding is more about building and maintaining systems. Next slide, please. Here are the allowable expenses under the stabilization program. And if you're a current CURSA recipient, you'll notice that they're very similar. You can see that you can use stabilization funding for personnel costs, for rent and utilities, for materials, for equipment and supplies, goods and services, and mental health services and consultations for program staff and for children. Next step, please. In addition, the Office of Child Care recommends that we give increased awards to providers who increase infant and toddler slots, add alternative shifts, and hire additional staff to reach pre-COVID accessibility for families. So we have a base, a formula that provides programs with a base amount, and then our ideas for the program design for stabilization is to give an additional increase for providers who are currently have increased slots or add shifts or hire staff, and also for some other components as well. Next step. So I just wanted to take a minute to talk about the current CURSA program, if you're not familiar with it. This is a federal program that we're running right now. It began in April and it goes until December. Grantees receive an award for every month that they're open and providing care. And just yesterday, we made our 4th monthly payment. This slide we developed when we had 3 monthly payments out. But yesterday, we had added an additional $1 million to the payments that we have provided to regulated providers through this program. Next slide. So this slide, you can see how similar the allowable expenses are between CRRSA and stabilization. It will be important for CRRSA recipients to think about their ability to spend and track and report additional funds should you apply for both at the same time. It's likely that we'll design the program so that applicants can choose. If you're not a CRRSA recipient, then you would apply for ARPA funds, immediately when they begin. If you are a CRRSA recipient, then you'll want to think about whether you can spend both of the allocations at the same time, or you can decide to start the ARPA funding in January when CRRSA ends. Next slide, please. Another component of this program is relief for families. We may ask you to certify that you're willing to eliminate late fees during program operating hours, that you create pre-COVID access for families, or that you provide families relief from co-payments, families who are receiving subsidy. And now I'll hand it over to Nicole, who will walk us through some activities.
Thank you, Sheila. So what we wanted to do today were some idea boards. So the first idea board that we added to earlier, as Beth said, this is a re-recording, had to do with ARPA stabilization funds. And what that's going to do is inform CDD's planning and also inform questions to be added to the upcoming survey. There's also instructions about how folks added to that idea board. So the following slides are actually screenshots from the idea board we had that we did export into a PDF, and we will be sharing. So a couple of the categories that we had on the ARPA stabilization brainstorm were equipment, goods, materials, supplies that providers would like to cover with ARPA stabilization funds for their programs. The next category is personnel costs and services that would need to be covered with ARPA stabilization funds. A lot of great ideas on here that we will compile. Other categories are timing of receiving ARPA stabilization funds and workforce barriers and needs. So I'll just pause for a minute. So if you're watching this recorded, you can take a look. So next we get into the other category, which is the discretionary funding through ARPA. And here are the lists of all the allowable expenditures. When we talk about discretionary funding versus stabilization funding, we're talking more of systems level with the discretionary funding, whereas the stabilization funds are more program level, what you would do in your individual program. So here we want to talk about systems. Also, as Sheila already mentioned earlier, the process for applying for this funding will actually be through our state's RFP process, request for proposal process. So entities interested in having this funding will submit a proposal and it will be awarded that way versus the stabilization and CRRSA funds, which are through an application process where as a provider, you submit the application. This is a little bit different there. I will pause for a minute so you'll be able to read the categories. And then I'm going to move to the next idea board activity that was done. And And you'll see this little disclaimer that we realize that the categories for ARPA discretionary funds are broad. And so this is just the first forum where we would like to collect feedback on ideas for this funding. We will also, again, be putting out a survey that will allow for additional feedback and then likely additional public forums to talk about discretionary funds specifically. Here is the idea board that was done. We have a lot of ideas, and you'll notice that there are also a lot of likes on the individual ideas. So we did get a lot of feedback here that, again, we will consolidate and disseminate. And the next steps from this webinar is to post the webinar to our CDD website as well as partner sites. We're going to use the information from today for a survey and program design. The survey that we've talked about a couple of times now will be emailed broadly and posted to websites as well. So it'll be readily available for you all to participate in. And then we will hold another webinar to explain the program design and application process once that's finalized. So we thank you all for participating and for watching this recording, and we will talk to you on another one soon.